Uh, Good afternoon, everyone. Thank you for joining us today for our Researcher of the Month spotlight. I'm your MOASC president, Ashkan Lashkari, and for the month of September 2023, we're honored to highlight Dr. Alexander Chehrazi-Raffle from the City of Hope, who's a genitourinary medical oncologist. Dr. Chehrazi-Raffle is an assistant professor of medical oncology over at City of Hope. And we're excited to have you join us. Thank you so much.
Thank you for that warm welcome. It's truly an honor to be in the company of such local legends as Dr. Omid Hamid, Elizabeth Buddy, and Rana McKay. So really
Yes,
thrilled to be
yes,
here.
we're very proud of our honorees and you among them. Dr. Chehrazi-Raffle, I wanted to just touch base with you about, your areas of interest within the GU space, and tell us where your main interests lie.
Sure. Yeah. So my research is centered around developing new strategies for patients with genitourinary cancers with an emphasis on prostate, kidney, and testis cancers. I'm also interested in biomarker research, particularly bespoke ctDNA assays for use in detection of minimal residual disease.
That last area that you mentioned in terms of MRD sense detection is something that we're seeing used across a number of different cancer subtypes, including colon and now being looked at in other areas, lung and breast, with
Yeah.
some of these commercial diagnostic tests available. Share with us some of the research that you're doing to kind of focus on these interests.
Yeah, for sure. So my interest kind of started during fellowship when I was working with my mentor, Dr. Monty Powell, on a collaboration with TGen, the Translational Genomics Institute, which is a partner of City of Hope. And we were developing a novel ctDNA assay that used whole genome sequencing to try and detect minimal residual disease in patients with metastatic kidney cancer on immunotherapy. And one of the challenges in that setting is that patients with kidney cancer typically are low ctDNA shedders, unlike others such as bladder, where we see very high rates of ctDNA in the blood. So we were able to differentiate partial from complete responders using that assay in a pilot study that was published in JCO Precision Oncology earlier this year. And it was the sort of impetus to launch that same format across all cancers, which we're currently enrolling for at City of Hope. So we're using a kind of revamped assay, building upon that experience to see if it can apply across multiple tumor types.
So this is a study that is currently accruing and enrolling patients.
That's right. Yeah. So it's very similar format to other bespoke ctDNA trials, such as the Signatera trials that many are familiar with in colon cancer, as you mentioned, and bladder. And so we're doing a longitudinal assessment over 6 time points across the first year of treatment for patients on immunotherapy, with particularly focusing on patients in lung cancer and genitourinary cancers, but it's open to all patients.
That sounds very exciting. And I know that's an area where a lot of people, including myself, want to learn more, since we're using this information, but it's not always easy to interpret in terms of if someone tests negative, can we stop therapy? Should we
Exactly.
continue? So there are a lot of exciting questions that need to be answered. It's nice to hear that you're doing this great work. Um, any other areas that you want to touch on in regards to your clinical interests and the kind of trials you may be leading to
Yeah,
answer?
definitely. So the two trials that I'm most excited about at City of Hope address some of the most underrepresented patient populations in GU malignancies. Those are refractory testicular cancer patients and non-clear cell RCC. Our refractory testicular cancer trial is a novel bispecific T-cell engager that targets Claudin 6, which is expressed during embryonic and fetal development, then becomes transcriptionally silenced in most adult tissue, and then re-expressed in more than 95% of germ cell tumors, making it an ideal target for this type of treatment. So although immunotherapy has kind of previously been unsuccessful largely in germ cell tumors, we're hoping that this more targeted approach will afford better successes. And then in non-clear cell RCC, I'm a big fan of our XL092 plus Nivolumab versus Sunitinib in patients with papillary translocation and unclassified RCC. XL092, for those unfamiliar, is a unique agent in that, unlike Sunitinib, it targets major signaling pathways involved in RCC like VEGF and MET, while also providing an immune permissive microenvironment via targeting TAM family kinases AXL and MER. I'm also particularly excited about this trial because it's a phase 3 trial and therefore will provide really high level evidence in a space that's historically relied only on phase 2 data.
And just to clarify, that's for newly diagnosed patients?
That is for newly diagnosed patients who have papillary translocation or unclassified RCC. So we're not including chromophobe in that one.
Okay, just as a reminder, what percentage of all kidney cancers does that represent? It's a small number.
It's on the order of about 15 to 20% if you take all three of those in aggregate.
Well, that sounds exciting. Well,
Yeah.
Well, listen, I want to let you know that this was a great discussion in terms of what you're doing, obviously a small but important slice. Our hope is that we'll have a list of these trials attached to this video so that our audience can identify these trials, and obviously if they have patients, refer them your way or contact you to make sure that if there's interest out in the community that we get these patients enrolled.
Fantastic. It's really been an honor.
Absolutely. Thank you so much, Dr. Chehrazi-Raffle. Thank you for joining us.
Appreciate it. Take care.
Bye-bye.